Session with BabyChakra. I'm your host, Kavita, one of the oldest mom stars in BabyChakra and your app moderator too. We have with us Dr. Amiti Agrawal and Dr. Falak Joshipura. This morning we are going to have a discussion on really important topic. Before we begin, I want our audience to have a general insight into BabyChakra, what our platform is all about. BabyChakra is India's largest pregnancy and parenting platform. It's one-stop destination for pregnant women and expecting parents. We try to connect parents with experts who bring valuable information and research-based information for all of us. On that note, I would like to kickstart our topic today. And we are going to have an informative discussion today on everything you must know about IVF in India. And we have two amazing doctors with us, Dr. Amiti and Dr. Falak. So we would take a few minutes to introduce Dr. Amiti and then we move on to Dr. Falak. Hi, Dr. Amiti. Please introduce yourself.
Hello, I'm Dr. Amiti, Medical Director of Sunshine Fertility and IVF Center. I'm running 2 IVF centers and 1 Gynaecologist, and it's a pleasure being on this great platform called BabyChakra. Thank you for having me.
Welcome to this live session. Dr. Falak.
Okay, so this is Dr. Falak Joshipura, and I'm a consultant physiotherapist with Aditya Birla Group right now. And I particularly work into, all these things, health and fitness, and I'm a big enthusiast. And it's my pleasure to be here and help the audience.
We are really grateful to both of you to having spared a few moments for us and our home stars and all of us in BabyChakra. Thank you so much. And then let's start the program. So let me introduce our audience to the topic once again. We are going to discuss everything you must know about IVF in India. In vitro fertilization is a treatment for certain kind of fertility issues. Knowing what to expect can make IVF easier to manage. It is a multi-step process. Patience is everything. Let's decode to know more. Let's discuss the best way to indulge the conversation with our experts in the panel today and have an in-depth discussion on this important topic. So round one, and we go on to the question. Dr. Amiti, my question to you is, what is IVF? How does the process work? Doctor, you are not audible. I can't hear you. Yeah, please.
Yeah, so can you hear me now?
Yeah. Please go on.
Yeah. So as you all know that nowadays there is a cases in India. Lately we saw that out of our gynaecologist barely 5% cases, but now it has increased to almost 20-25%. There are various reasons for that, which is a rise nowadays in India. It could be changes in lifestyle, late marriages, changes and all of that. So there are various parameters which have led to increase in infertility. So basically, fertilization, it is a form of assisted reproductive technology. In we move from the patient's body, the sperms are taken, the embryos are created outside the high end in a very clean environment, and those embryos which are made, they are put back into the infertility. IVF now is almost a 46 to 48-year-old process, and it is a very safe procedure, and it has got very good results. Initially, when I was only about 25 to 30%, but now with advanced technology, with the good use this kind of equipment which are available, the success rates have increased to about 55 to 60. Basically, in IVF, just in IVF and in IVF, we just allow the sperms to automatically, we just leave in a petri dish. We collect and we just leave the sperms from the top, and we allow the sperms to fertilize the eggs on themselves. We take one sperm and we take one egg, and under a very good microscope, we inject one sperm into one egg. This is known as intracytoplasmic sperm injection. Sperm injection basically is done for patients who are having very poor sperm motility, and that helps in improving the success rates a lot for IVF.
Right. Thank you so much.
So
Thank you very much.
Yeah,
Please.
about 10 to 12 days of injections, because as you know, in a normal cycle only about one egg formed by the lady's body, but through this form of these injections we try to so that when we are doing the egg retrieval we have a good oocyte yield.
Right. So coming to Dr. Falak, how physiotherapy can help women get pregnant?
So basically, there are few techniques which are involved. Okay, first of all, I'm talking about some basic things. Okay, there are few reasons why women are not getting, fertile, and they are facing fertility issues. One of them is abdominal fat. This is also a reason why they have this infertility issues and everything. So first, physical therapy in very basic manner, it can help by incorporating exercises and basic protocol like high intensity interval training and little bit of strength training as well, which will burn that visceral fat basically. Okay, like there are two types of fat. One is a better one, brown fat, and another one is like white fat, okay, which is like not at all good. Then this particular exercise and whole regimen can help in that one. Another technique is known as Mercier technique. Okay, so what is involved in this technique is that it is like found by a physical therapist in US, and it is also propagated by American Academy of Fertility Care. And it's like in this technique what they do is by positioning the organs and breaking up the scar tissue. Okay, they are facilitating the making the system more healthier for the women to bear the child. Okay, so basically this Mercier technique is another which is more scientific form. Basis is like basically burning the visceral fat and eradicating that particular obstruction which is there in inducing fertility. Second technique I talked about is this Mercier technique, in which they manipulate and break down the scar tissues. Okay, this is like technique which is not really very common in India, and there are just few physical therapists who are working on this technique right now, because it is not enough propagated and there is not enough awareness regarding the same. But yeah, in US and UK this technique is like quite popular and people are really, but yeah, you can say that success rate can vary. Okay, depends on the cause of infertility. If the cause is something different, then it cannot help in that particular. For that you have to surely go to a infertility specialist, but this can be used as an alternative therapy, right, along with your treatment.
Okay. Great. Thank you so much, for Dr. Falak, for this insight. And coming on to the next question to Dr. Amiti. When should a couple think about undergoing IVF, and what extra precautions should be taken? Hope you can hear me, Dr. Amiti. Shall I repeat the question, Dr. Amiti? Can you hear me, Dr. Amiti? Am I audible?
Yeah, I think there's a network problem. I'm not able to hear you actually.
Shall I repeat my question?
I'm unable to hear you.
When should a couple think about undergoing IVF, and what extra precautions should be taken?
I'm not able to hear.
I'll come back to you then. Let's move on to Dr. Falak, and then I'll ask Dr. Amiti once again maybe. So, Dr. Falak, I'm audible?
Yeah.
What type of exercises increase the chance of fertility?
So basically, as I explained earlier, any kind of exercise which helps in burning the visceral fat can help in inducing the chances or increasing the chances of fertility. I recommend, especially if there is someone who is coming to me, like in my whole career, I have seen like one or two clients facing these issues and coming to me basically because there's less awareness, as I told, okay, regarding this particular thing. So I recommended them the high interval intensity training for this particular cause, and they were like quite confident. And after they started, not after starting with IVF, okay, I'm talking about just infertility issue, they were not taking any kind of meds, any kind of treatment, any kind of injections, they were just facing this issue. And their gynec told them that you are facing this infertility issues because of your abdominal fat. Okay,
Mm-hmm.
due to the uterine lining expansion, the uterus is not being able to expand due to this abdominal fat that you have.
Great.
So that
Great.
was the sole reason they were facing this issue. So the goal was to lose some weight and lose some abdominal fat. So I
Mm-hmm.
recommended them high interval intensity training with a good combination of strength training and abs exercises, abdominal exercises and all.
Okay.
So this will help if you are facing issues due to your abdominal fat. But after you start with the treatment with a gynecologist, I wouldn't recommend high interval intensity training.
Okay. 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 Great. Thank you so much. Next, we have a few questions from our audience too,
Yeah.
and one of the questions for you is: I am trying for IVF. What are the precautions I need to do while I do the exercises?
Okay, so you have started with IVF, and that's the reason you are in a very crucial phase. Okay, this is like I tell a very sensitive phase in a person's life because it is very important, and you need to take precautions while exercising. Particularly, I will recommend to ditch high intensity interval training. Do not do exertion or any kind of work that involves exerting your body. So I will recommend few stress relief exercising, few very mild stretching and yoga particularly, and exercises that are relieving your body stress. Okay, and otherwise I wouldn't recommend any kind of harsh exercising or extreme exercising. Okay, and one another guideline, okay, which was propagated by a study in a gynecology study, it was not a physical therapy point of view I'm talking
Right.
about.
Right.
They told that do not exercise for more than 4 hours a week when you are undergoing an IVF treatment. So make sure that per week you are exercising for just 4 hours in total, okay, and
Mm-hmm.
not more than that. That is like half an hour per day or 1 hour per day for just 4 days, and not more than that. Other days keep it for rest and relaxation. Okay, and always aim for exercises that are relieving your stress.
Right, right, right. Thank you so much. Uh, I think Dr. Amiti got disconnected due to the network issues, I guess, right?
Yeah.
Anyways, no problem. Moving on, and any takeaway messages you want to give? Any special message you want to convey to our moms?
So there are one or two things that I would tell to the moms who want to conceive child and facing problems in that. First is diet is very important. Exercise alone will not do any kind of good. Okay, diet is very important. Eat fertility inducing foods, enough proteins, and also dates can work magic, can do
Oh, is it?
wonders. Okay, dates, yeah, yeah,
Okay.
absolutely. I have tried this on my few of my family members, and they actually saw the results. Changing your diet and
Mhm.
controlling your hunger pangs, and
How does
can
date help? I mean, what is so special about dates? I mean, if you could explain to us, it would be great.
So basically, dates are something in which they in Ayurveda they tell that date induce a
Mm-hmm.
kind of heat in your body. So
Mm-hmm.
whatever is inducing heat in your body is very very beneficial to create a fertile environment inside. Okay,
Okay.
so that's the sole reason why I would recommend dates, and also they help in insulin resistance and every kind of that kind of thing. Okay, because of the glycemic index, particular that kind of specialty of the date. Another thing is taking vitamins. Okay, there are many vitamins that women are lacking. Okay, like I'm talking about a patient who came to me, she was lacking B12. When we did the reports and we went ahead with the scans and everything, she was deficient in B12. Then how will she create a fertile environment when she herself is not healthy enough, right, to conceive? So basically, diet and nutrients play a very big role. Another takeaway message is that please be active. Okay, because when you are having a good gut microbiome and a very healthy body, it's very easier to conceive. Okay, when you are like unhealthy and sluggish and everything, then you have higher chances of developing PCOD and PCOS, which might hamper your fertility. Okay, so this is another takeaway message. Stay active, move your body every single day, even like 30 minutes per karo. Okay, this is staying active is very important. Even if you are getting married in some while or something like that, please stay active. Okay, and another message is that high interval intensity training can really help, okay, before IVF. But after starting with the treatment, never go for it. It will be the biggest mistake, so keep this in mind.
So this is very important. I mean, our moms who are trying should know that this is very important, and it should be done under proper guidance, right?
Yeah, absolutely. Never ever. Just because you are hearing this live session, don't कि भाई मैं तो expert
Exactly.
हो गई मैंने सुन लिया. No, please consult your expert. Okay, like consult your gynecologist, or if the gynecologist is saying something like you have issues due to your weight or abdominal fat, you are like just too fat, okay, for conceiving a baby, and uterus is the lining is not, then consult your physio, or any kind of person you trust regarding fitness and everything, who can help you in losing that particular fat.
Thank you so much. Thank you very much for this insight and for your helpful tips and suggestions, and taking out some time from your busy schedule. We from Baby Chakra and from our viewers also, we thank you very much. And once again, we come to the end of this session today. And thanks to you, Dr. Falak and Dr. Amiti too. Thank you very much. And we are sorry that there were some network issues and Dr. Amiti could not continue the discussion, but we'll have her once again. Don't worry. And, thanks a lot, our viewers. Keep following us. Keep watching Baby Chakra and the parenting videos and the tips which we share with all of you. Happy Diwali to all of you. Thank you.
Happy Diwali.